Hi, my name's Scott. I'm a nurse manager with BrightStar, and for the month of February, as you might have guessed, we're going to be talking a little bit about the heart. Now, according to the CDC, the leading cause of death in the United States is heart disease, and it actually has been for almost 100 years. There are many different types of heart disease, different forms, but two of the more common ones that we're going to address today are atrial fibrillation, abbreviated AFib, and congestive heart failure, abbreviated CHF. So it helps to think of the heart as a water pump. With a water pump station, you have your pump, your pipes, and an electrical conduction system, or the control panels that regulate the amount and flow that go through the pipes. And the heart's very similar. The heart itself is a pump. It has pipes or blood vessels, and it has its own conduction system or wiring. Now, we won't get too far into or too in depth in the explanation of that because it can get a little complicated. But generally, that's a good brief overview. The heart is also comprised of 4 different chambers, 2 smaller ones on the top, or atria, and 2 larger ones on the bottom called ventricles. So the way the blood flows is it will enter the atria, or the top chamber, fill, and then be pumped to the lower chamber, or ventricle. And depending if you're on the right or the left side of the heart, the ventricle will either pump the blood to the lungs to be oxygenated again, or out through the aorta to the rest of the body to oxygenate the tissues. And that's the basic flow of blood through the heart, or the pump. Now, when you have the condition atrial fibrillation, the top chamber, the atria, instead of pumping steadily, what it'll do is there'll be massive amounts of electrical activity coming from different points usually, which will confuse the electrical system, and so what ends up happening is the atria starts to quiver instead of pumping strong. So when it's quivering, the blood likes to pool there, and you don't get an effective pump into the ventricle, so it ends up affecting your overall cardiac output. Some common forms of treatment for that would be cardioversion, where an electrical shock is usually delivered to kind of press the reset button on the heart, or the SA node, and hopefully the heart will take back over to the rhythm that it was on before, and you won't have any problems. They can do something called an ablation if the surgeon thinks it, or the cardiologist thinks it'll be helpful, where they either burn out, freeze, or use radio frequency to knock out the area that's causing the problem, so you won't really have any issue with extra beats or extra electrical activity in that part of the atria anymore. And thirdly, a lot of medications can be used to help treat atrial fibrillation. Now, the swath for that is pretty wide, so we won't get into that too much, but a very common one is a blood thinner for a patient to be on. Now, that can be Coumadin, Xarelto, Eliquis, and there's a number of others. And the reason for that is when blood pools like it does with the atria, because we're not getting that strong contraction or atrial fibrillation, because it's doing this, blood's pooling there. Whenever blood pools, clots like to form. So you don't want a clot traveling through the heart, going into the lungs, causing a pulmonary embolism. You can also, depending where the clots form, you can have a deep vein thrombosis or stroke, because then the clot would be, once it's pumped out of the heart, there's a very high chance it would go to the brain. So with congestive heart failure, or CHF, the chambers of the heart aren't either able to fill adequately or pump out adequately enough, and as a result, the heart itself becomes overloaded or congested, and that's where congestive heart failure comes from. Now, when you have this inefficient pump, what happens is when the fluid backs up, it can start affecting the lungs, where you'll have trouble breathing or shortness of breath, overall fatigue because your cardiac output is lower. You'll see things like swelling, and normally it's very common to have swelling in the feet or in the lower extremities and the legs, but you can also get it in the hands, and sometimes palpitations too. So some common treatments for congestive heart failure, or CHF, are a diuretic or water pill, and what that does is help get the excess fluid out of the body, so it takes some pressure off the pump. Dietary regulation. In the American diet, we have a ton of salt in everything, in fast food, and most of the preservatives on the shelf, unless it's fresh. So what water does is it follows the salt, and if we have all the salt in our body, that's bad for the heart. So dietary regulation, cutting down on that, prevents the salt from just being present in the body, and that'll ultimately take pressure off of the heart. So dietary regulation is very big, and on that, limiting or eliminating the, depending, if you need your cup of coffee in the morning, caffeine, because you don't want an arrhythmia or palpitations as a result of taking in too much caffeine, which can exacerbate the situation as well. And finally, depending on the cause, surgery, if the cardiologist thinks that maybe a pacemaker or another assistive device would be beneficial, then that would be an option to be considered. But it's a very manageable disease as long as you are, on top of the medication and watching what you eat, kind of regulating your diet. So hopefully you found this informative with the common types of heart disease and the treatments for them. All right, have a good day.